declined. We still have a backlog of cases that need to be entered by our data entry staff, who are working around the clock to get the seen the highest booster shot is available for the J&J recipients at 2 months after they've received that J&J shot. And then for those who have received the mRNA vaccinations, at 5 months, they can receive that booster of one of the mRNA vaccinations. Go to the next slide, please. I'm going to spend a little time talking about deaths, as this is a lagging indicator, but we've had fewer deaths in our community than other parts of the country or the state. As of yesterday, there were 1,237 deaths reported in Travis County since the beginning of the pandemic. We note now that less death has occurred in the third quarter of 2021 in the 70 plus population. And that is due to the fact that we took steps to protect that population with vaccinations and boosters, early on vaccinations and later in the year boosters. There's less death that's occurring right now during this Omicron surge. However, deaths, as I said, are a lagging indicator, and this surge has happened very quickly. So there's more to come on the impact in our community with regard to death as a result of this surge. However, so far we've had very few. If you go to the next slide, please. I want to look at vaccinations to look back at what I was talking about with regards to vaccines and protection from severe disease and death. And we've had 9.8% of the deaths that have occur in those who have been vaccinated. And that's what's represented on the in the graph that's on the right-hand side of this slide. On the left-hand side, you see a listing of the comorbidities that have been associated with each of those deaths that's occurred in vaccine breakthrough case. The majority of the cases reported hypertension as a comorbidity, followed by cardiac disease, diabetes, and immunocompromised state. Next slide, please. Reinfections have been reported, and a reinfection is defined as somebody who's had COVID-19 in the past and then becomes infected again. There are some in our community who feel that they have enough protection from the antibodies that are produced from an infection, but this shows us that, in fact, natural immunity is not as good as receipt of vaccine and booster. So we continue to urge people to become vaccinated after they've recovered from COVID-19 and boosted, so that they can be given that full protection and not develop COVID-19. And then my final slide is a comparison slide looking at what we saw 2 weeks ago in the landscape across the country. The pink peach coloration is the color that's used by the Johns Hopkins group to show an increase in the number of cases. The lighter green teal color is what's used to show a decline in the numbers of cases. And as you recall, South Africa saw a rapid increase in cases with a rapid decline as well. And we're seeing that there is a decline that's happening in various parts of our country and also here in our local case numbers. The important thing for us to remember is that we've been in this spot before where we've been on the decline and anticipating a quiet hiatus afterwards. What has happened when we start seeing these declines is that people start to relax their mitigation efforts, and there's a shying away from really getting out there and getting boosted and getting vaccinated if you haven't already gotten the vaccine. It is really important for us to continue to get our community vaccinated and to continue mitigation efforts to stop the spread. As long as we have a large number of susceptible individuals in our community who can and may become infected with COVID-19, we have the risk and run the risk of being in a situation where we are faced with hospital capacity challenges and economic challenges, and everything that we can do as a community to continue to keep this virus from spreading and to protect particularly our children will be important in the weeks and months to come. With that, I'll end my report.
Thank you, Dr. Walks. Director Stirrup. I think you're muted, Director Stirrup. No, can't hear you.
Judge.
Yes, sir.
In the meantime, while we're waiting for her to get on, I'm wondering whether we could ask whether we can look at the countywide distribution of breakthroughs by vaccine type. Is that possible? Because J&J, if we could look at that, maybe that could give us a little insight that we currently don't have. Is that possible, first of all? And if so, could that be added?
Actually, on that slide, the type of vaccine is listed on that graph that I was showing.
Okay, and what page is that?
I think it's on the screen now.
Was it on the screen? I saw the
Yeah.
screen, but I don't think it listed. Oh, it did?
Yep.
Can you go back to that?
Yeah,
graphic,
let's go
please?
back to that because I didn't see it in my deck.
Yeah, it's slide 10.
Yeah. And Chuck sent it to you also.
It's slide 10.
Yeah. Thank you.
It's been missing from my deck.
I'll send it to Commissioner Truly. Director
You-
Stirrup.
you- You'll have to help me, Dr. Walks, because I'm joining from the web version today and I can't see.
Slide 10, that's it.
Okay, yeah, I can't see the slide numbers in this version.
Back up and
Just tell me when to stop.
no, go back the other way, sorry.
One more?
No, you passed it. You have to go the opposite direction that you're going in.
Forward or back in the presentation?
Back in the presentation.
All right, thank you. I'm struggling here this morning.
Okay,
It's
that's not number 10 in my slide deck.
Yeah, I'll get it to you. Director Stirrup, do you want to go through your presentation and then I'll try to find it here while you're.
It's in slide 10.
What is that dinging sound?
Right there. Stop.
Right here.
Back one more. Go again.
think you mean forward.
See, that's my number 10.
Go back.
Dr. Sturp is trying to get to her present.
There it is.
Okay.
Okay, thank you. All right, we've
Oh, they did put it on the screen.
So Janssen is the lighter green, and then we have that middle army green is the Moderna, and the darker Kellyish kind of green is Pfizer, right?
Correct.
There's many more breakthroughs with Pfizer.
Yes.
Thank you.
Thank you.
All right, Director Sturp, go ahead.
All right. All right, so as you can see, again, I'm begging a little pardon. I'm not used to joining from my web browser, usually from the app, so my computer is doing different things. So I'll just try to make it through. This first slide is the operations overview for the month of January, and you can see through the 24th of the month, we've distributed 3,665 total vaccines. And you can see the breakdowns there with respect to doses, age, and booster. If you look at the bottom of the screen, a lot more tests were conducted during this month so far. 19,206 total COVID-19 tests, with the majority of those being walk-up appointments. The Expo Center has been a great site for the community, quickly followed by Dove Springs. And the Equity Line staff continue to tell me that mobile testing is booked out at least 2 weeks in advance. So here on our screen, we have our testing options that are available. And as always, if you are sick, please get tested. If you are exposed to someone who tested positive, please get tested. And when in doubt, please get tested. These are the sites that are available for the community. I know there has been some concern about the lack of evening hours for folks to go after work, and we are working on expanding those opportunities. But again, I say, if you are feeling sick enough to think you need a test, please call in and go get that test before you do anything else for the day. And so we're at the Dove Springs Rec, we're at the Expo. You can call 512-972-5560 to get in-home testing. And we are working to expand the staffing, training more staff to be able to go out and do more in-home tests. And we also continue to support our community with facility testing. When you look at Travis County vaccinations by week, we can see that 72% of our county is fully vaccinated for those 5 and older, and 84% of the eligible population has received at least 1 dose. For our pediatric population, 38.5% have received their first dose, and 27% are fully vaccinated as of the 24th of this month. In terms of our population that has been boosted, 41.5% of the fully vaccinated population, 30% rather, of the total eligible population, that's 5 and over, has received a 3rd dose or a booster. And then when you look at our total cumulative distribution by age, we see that the demand for boosters in Travis County has been driving most of our vaccine administration over the past 2 weeks. This chart is a breakdown of all reporting providers. And then when we look at the distribution of pediatric vaccines by race and ethnicity, there is some lag in the reporting from the state, but we can see that the gaps in our pediatric population with respect to race and ethnicity are not as prevalent as we're seeing in our adult population. And then when we look at the pie chart that shows the number of Travis County residents who have not received a 2nd dose, What we know so far is that approximately 210,000 residents are unvaccinated. Again, going back to the boosted population, 41.5% have been boosted, and 30% of the total eligible population has received a third dose or booster. When we look at our data, again, broken out by race and ethnicity, the lags in the populations of concern are still there. In our Hispanic population, there's been some incremental change, which I'm always appreciative of. Again, in the Black community, we've seen some incremental change in the percentage of fully vaccinated population. Since November, we've tried to be strategic about our attempts to reach the so-called hard to reach populations by making sure that we are in places and spaces. We use our zip code data to drive our outreach sites. We've implemented the gift card program, and to date, over 1,200 gift cards have been distributed, and the zip codes of those recipients have been 78617, 78741, 78744, 78753, and 78758. And that correlates with the areas of focus. If you look at our first dose vaccinated population map, we're getting there. I love green, and but only on this map. I don't think it does anything for my coloring, but on this map, green is my favorite color. And we can see that the majority of our areas have received their first dose. The diamonds and the dots on the map indicate the places where we've either had the mobile vaccine program visit. The white dots indicate pop-up clinics, and the black triangles are locations where we have our static clinics. So it gives you an idea of the reach that we've been able to have with our vaccine teams, and also indicates areas where more effort would be warranted. When we look at our map that shows our second dose fully vaccinated population, not as much green here, but there are some areas that are moving into the blue, and we're encouraged and excited by that movement. We still see that the 50% and the 50 to 59% areas are 78617, 78741, 4221, and 53. And again, if you overlay the places where our MVP team goes out and the areas where we have pop-up clinics, we are being intentional about where we send our teams to make sure that everyone has access to a vaccine. And so we get to our operations for the week. As always, all of our clinics are walk-up. There are no appointments needed. We have new hours at the Southeast Branch Library, where they're on Saturdays from 10 to 2. And we offer all three of the vaccines for 12 and up. We're in Pflugerville. And again, at Pfluger Hall, we're offering all three vaccines. And at that location, we are offering Pfizer for the 5 and up population. Delco is still going strong. Again, all three, and pediatric vaccines are available, and at Sims Elementary. The mobile team will be at a few events this week. Community First, Home Sliced Pizza, Dessau Middle School, Smart, Haka Property at Chalmers, the South Austin Market, and a few other places there. For the schedule, you can visit us at www.austintexas.gov/COVID-19, and that'll give you the latest and greatest of where our teams will be providing vaccines. And so when we talk about our communications, we have 3 key messages that we want to continue to push out to our community. Mask up. Stage 5 means that everyone should wear a well-fitted mask when leaving the home. This past week, we filmed a PSA that I hope will be out soon, advising our community to make sure that, when we say well-fitted, that there aren't any gaps or openings at the side of your mask, that it fits snugly over your nose. get vaccinated. Vaccines are still showing to be the #1 protection against COVID-19. And so get yourself and your kids vaxxed and boosted. Omicron is continuing to affect our kids at an alarming rate, causing hospitalizations. And we know about the staffing shortages due to staff being sick themselves. So everyone 5 and older can get their shots. So visit any APH, local pharmacy, HEB, and get that vaccine. And lastly, if you have a sniffle, a drip, a cough, a sneeze, please get tested. I know there are a lot of things going on in our community at this time, from cedar fever to flu, but with the spread of the Omicron variant and how contagious it is, a little ounce of prevention is worth it at this time. So please be tested before going out. Okay, and this slide just shows some of our communication efforts. We continue to amplify our presence in social media with different messaging, from anything about the latest and greatest numbers on our dashboard, about the importance of masking, getting boosted, protecting yourself and your loved ones. So here's just a sample of some of the messages that we have put out. Our community outreach continues. We continue to recruit and build that CHW team. So far, we've reached over 1,600 individuals through our efforts. And on the screen there, you see some of the places where the teams have been out engaging with community. And of course, in addition to that one-on-one interaction and outreach that we get through our CHW team, we do continue to partner with large-scale events, tying it to PPE and food distribution, because we know we have a crowd of folks that are coming in. And these pictures here are the cross-disciplinary teams throughout the city of Austin, represented here at Gus Garcia. And we were able to give out 1,200 PPE bags, 600 resource bags. We gave out food, lip balm, information about WIC incentives, and other things. So we understand that COVID has an impact on all areas of our community and social determinants of health. And so we are making sure that all of our programs have a well-rounded approach to addressing community needs. And with that, I will end with a picture. I believe the folks on my right, I'm looking, are at Jester King Brewery. We were out there giving out vaccines. And then the other to the left are the teams out at Expo. And that just shows the dedication, because it was cold that day. So we were bundled up and we were masked up, ready to serve. And with that, I thank you for your time, and I end my remarks.
Director Serpchuk, before you start, just want to I got a notice from our city manager, Spencer Cronk, that interim director Adrian Stirrup is now Director Adrian Stirrup. So congratulations, Director Adrian Stirrup, for being Director of APH. Thank you for your service.
Thank you. Thank you.
All right, that big news. Chuck, I'll pass it to you.
Thank you, Judge Brown, Mayor Adler, commissioners, council members. Congratulations to Director Adrian Stirrup on her appointment as the permanent full-time director of Austin Public Health. It's a pleasure working with Austin Public Health, Director Stirrup and Dr. Walks. I'm here today with Constable George Morales and Todd Hamilton with Central Texas Allied Health Institute to update y'all on the activities of our Texas Travis County Vaccine Collaborative. And at this time, I'll turn it over to Constable Morales.
Good morning, commissioners, council members, judge, and mayor. The goal of the mobile vaccine teams is to continue to offer barrier-free vaccines, outreach, and education to our most vulnerable zip codes and hard-to-reach populations. This week, we gave a total of vaccine shots of 1,238, and the Mobile Vaccine Collaborative gave a monthly combined shots of 6,980. We will continue to put on shot clinics in highly affected zip codes in Austin, Travis County. We will continue to move forward with working with our community partners of Seton, APH, Central Texas Allied Health, and of course our Precinct 4 teams. We will continue to target areas in the 78758, 78753, 78724, 21, 41, Del Valley, Austin Connolly, and also 78744. We will be this week at Mendez Middle School, Blazier Elementary, Boys and Girls Clubs, Harmony Schools, Idea Schools, and also the Mexican Consulate. We will continue our static locations at JD's, La Mexicana Supermarkets, Expo, El Rancho, and La Finca. And I'm going to give a shout out to our seating teams, Central Texas Allied Health, our Precinct 4 outreach team, and our Precinct 4 deputies, because the hard work and the weather that they had to endure last week, they continue to push through it. They continue to show up, and they continue to give shots. Shout out to everybody out there working hard to get everybody vaccinated. I'll turn it over to Chuck.
Constable, thank you. We don't have Mr. Hamilton here today. Instead, we have Dr. Jerica Thomas Hockaday, who is the co-founder of the Central Texas Allied Health Institute. So I'll turn it over to Dr. Hockaday.
Good morning, Chuck. Good morning, Council and Commissioners Court. This week we did 325 shots. That is including pediatric and adult vaccines. We continue to do our work in the community as we have done thus far. We are at a new location this week at the African American Youth Harvest Foundation. We have a permanent partnership with them now in their building to be able to provide vaccines to their community as they come in for services. So we will continue our work at our static location and as needed in the county collaboratives process. I'll turn it back to you, Chuck. Thank you.
Thank you, Dr. Hockaday. Judge, Mayor, Commissioners, Council members, I just always like to show y'all our schedule for public-facing schedule for vaccines available on Travis County's website at traviscountytx.gov. A quick link to our COVID-19 information in the upper left, and that takes you immediately to our day-by-day calendar. So today, Tuesday, January 25th, you can see locations not only for the Travis County Vaccine Collaborative. We will be at JD's Supermarkets today, African American Youth Harvest Foundation with Central Texas Allied Health's work, Bastrop County. We've also got a couple of Austin Public Health's events as well scheduled here. Click on any one of these and you'll see the location, the hours of operation, the types of vaccinations available. And this is updated, kept current, and easily found on the Travis County website. Judge, at this time, we will pause and turn it back to you for questions.
Awesome. Thanks, Chuck. Thank you, Constable Morales, Director Stirrup, Dr. Wilkson, everybody. Dr. Jerica Thomas Hockaday, good to see you too. Thanks for all you're doing. We'll go to the questions now. First, we'll go through the commissioners, and then we'll go through the city council members, and we will start off on our side, see if Commissioner Gomez has any questions or feedback for this. If not, we'll move to Commissioner Shea.
Did Commissioner Gomez have a comment? Okay. I had two quick questions. One, do we have any indication of how severe the reinfections are when people who are relying on what they think wrongly think may be sufficient natural immunities from having gotten COVID? Clearly, they're getting reinfected. Is there any data on how severe the reinfection is when it occurs?
No, we just get anecdotal reports from our case investigation team, and I can ask for a report and get back to you about that.
Okay.
Anecdotally, some people have mild disease and others have very severe disease and end up in the hospital. So it's all really based on what the baseline health of the person is who's impacted the second time around.
And I just have to remark, I think the fact that we cannot get agreement, and I fault the state in large measure because the governor and the lieutenant governor have been so aggressive in attacking school districts that attempted to have reasonable mask mandates. But without a uniform policy, we're seeing just tremendous chaos in the schools. So many kids getting sick, so many teachers, so many staff getting sick, schools having to delay, shut down, et cetera. I know this is falling on deaf ears at the state level, but I just have to say, we have to get agreement around a sane and uniform policy to tackle the pandemic. I'll leave it at that.
Commissioner Trevilian.
Okay, one item I want to point out and then a question. When I looked at that, when I looked at the slide that I requested, slide number 10, my biggest concern was, I want to make sure that we give context to the entire community and don't give them anything that might lead to misinformation. What I mean by that is, I really want to understand from the standpoint of proportional representation, how many boosters or how many shots have been given out by Pfizer, Moderna, and J&J, because it seems to me that when you just list the numbers and not the proportion, because you have given more of one type of shot than, say, than the third type of shot, it makes it seem as if there are more instances with the one that has been given the most, rather than laying out what it is as a proportion of the shots given. That's kind of the assessment that I want. If maybe Pfizer has had the most number of breakthroughs, but how many shots have we given of Pfizer versus the breakthroughs, and Moderna versus the breakthroughs, and J&J because of the breakthroughs, so that we can see that in context. Because when you look at a number that's significantly higher, I think the average person says, "Wow, that group is maybe that shot isn't the one that I want to take." When you look at it proportionately, it might be. So I just want to make sure that we add the context that tells us how many are given versus the breakthroughs of it, or of that.
Right, and you're right, Commissioner, because looking at that breakthrough slide that you're looking at and referencing right now, Pfizer has had more breakthrough cases reported. Let me first say that we aren't always able to reach all of the cases to get information from them. And so that graph represents those people that we've been able to reach. Second, the first vaccine that was out was the Pfizer, and that was given to a lot more people early on. APH used Moderna predominantly, so you're correct in the comments that you just made, and we'll try to get that information for you.
Thank you very much. You and your team are always very responsive and have done a wonderful job. I just want to make sure that I'm asking contextual questions as we try to serve a sometimes skeptical community. So my question is, I like that when I look at the community outreach slide and it tells me the zip code areas that you're working in and the different complexes that are in those areas, I appreciate that. I wonder, have we looked at our entire public housing portfolio by zip code? Have we looked at what is in our portfolio from the Housing Authority? What is in our portfolio from the Travis County Housing Authority? And identified which zip code areas they are in, so that we can make sure that we're reaching out to them, and if families and children need access to the shots, that they will have access, particularly in our public housing facilities.
Thank you for that question. And the short answer is yes. We do have those connections related to the work that we do with chronic disease prevention, as well as our HIV outreach. And so it's a process of connecting with the different resident managers to make sure that we can have a presence there, and scheduling and organizing. But because those are the spaces that we traditionally have done our outreach work, we do have those connections, and we will continue to broaden our reach in those various properties.
I really appreciate that, and it would be nice to have a listing of the public housing facilities that are on the map, and then be able to demonstrate that we've reached 50% of them or 75% of them or 95% of them. It'd be good to have a matrix to report that, just so that we can understand that all of the public housing facilities and all of our affordable housing portfolio has been reached out to.
Thank you. Commissioner Howard.
Thank you. I think Adrian's Director Stirrup's last slide of the ladies bundled up shows the commitment by this community to get the shots in arms, and what Constable Morales said about the bad weather and people continuing to do the work. I'm appreciative. Related, is there any data yet about the number of folks that came to our warming centers or shelter during the freeze nights? About, what did you learn about who had been vaccinated, who might have been testing positive at that juncture, especially of the folks experiencing homelessness who came in for help?
We do have that information, and I can send it to commissioners and council. At the check-in point, we do offer vaccines to everyone. I think at this last activation, we didn't have any takers on vaccines, and we do also record the tests that were administered and the number of folks that were transported to ISOFAX as a result of that. But testing is not a requirement to access the shelter, because we want to be respectful of individual choice. But I can get that information for the last 5 activations and send that out.
Thank you very much.
Thanks. Got a couple things. One, just wanted to say that we now have a regional director for let me get the name right. United States Department of Health and Human Services has appointed a regional director for our area. Her name is Seema Lajavarian, and we have talked with her over the past few weeks, and she's been wonderful and has helped us get this. There's going to be a testing site here that HHS is providing. Still working on the exact location, but want to thank Regional Director Lajavarian for her assistance in getting that here, and also thank Congressman Doggett for his assistance in getting that federal asset to help do additional testing. We'll have more details in a few days, I think, about the exact location, but I think it really will help get a lot more folks tested here in Austin and Travis County. Also want to give a shout out to Judge Cliff Brown and Dr. Walks. We have been working together with BA Garza, Judge Kennedy, others, I think Judge Urrutia, over the past couple of weeks to figure out how to start doing testing to get the criminal jury function happening again here in Travis County. And we're making good progress on that. Not quite there yet, but hopefully we will get back to a place soon where we can start having criminal trials again. And one question, I think, for Director Stirrup or Dr. Walks, on the pediatric vaccine slide, I see, again, like as you noted, Director Stirrup, the demographics of folks being vaccinated with pediatric vaccines more closely mirrors the population demographics as a whole, which is good than I guess the initial full adult population vaccine effort did. I didn't see the number, and you may have said it, I may have just missed it. What is the number of pediatric vaccines where we are right now? Do you know that number offhand? And if not, I can get it later from y'all. Just didn't see it.
Yes. Yeah, can I reach back out to you and the full court and council?
Absolutely.
Thank you.
Cool. Thank you very much. And with that, Mayor, I'll pass it over to you for y'all's questions.
Judge, thank you. Colleagues, we're going to start with District 10, work our way backwards. So we'll begin with Mayor Pro Tem.
Good morning. Can you hear me okay?
You're kind of faint if you get a little closer.
Okay. Can you hear me better now?
Yes.
Okay. I wanted to, first of all, give a shout out to our staff. I was talking with a trustee at AISD, and they were really praising of all the work that APH and the county have done to help them with the various tasks that they need to take to help to keep our students safe. This was totally unprompted, and I think it's important that we share that information. We have my question, I'm not exactly sure who this is for, but my question relates to an item that we have on our agenda this week that relates to the relationship between the county and the city with respect to carrying out our public health activities. It's item 48. That item covers a lot of activities, and I believe it covers mostly the normal activities that are the subject of the relationship between the county and the city through our work together with APH. As I read it, it does not cover COVID. And I've been asking questions over the last 22 months about how the county is contributing to APH's contributions to addressing COVID in our community. So can someone please speak to the financial contributions that have been made by the county to APH and where that's being covered and how those discussions are happening?
And so I'll start, and I'm sure that Chuck will have some things to add. We continue to negotiate what those costs will be. We're trying to navigate between what is eligible for reimbursement and what costs are not. We did have an agreement in place that covered activities through December of 2020. And I don't have the exact dollar amount with that. Maybe Chuck has those. So we're continuing to talk about from that point forward, what would be a good fit and what makes sense for the city-county split.
And thank you, Director Stirrup. Mayor Pro Tem, yes, we continue talking about and discussing and negotiating a cost-sharing interlocal agreement between the city and the county to address our shared services, our shared procurements, anything that we are doing together is as part of our joint response to the pandemic. So the 2020 agreement that Director Stirrup mentioned used our CARES funding. You'll recall that the county contributed about $7 million out of the county's allocation of CARES dollars and paid the city as part of that 2020 interlocal. So this time around, instead of CARES money, we are looking at the American Rescue Plan Act, the local fiscal recovery funds, ARPA, LFRF dollars, and we are still talking about which costs we do share jointly, which costs we will not be seeking separate reimbursement from FEMA for through the public assistance program, and then what the amounts are going to be. So the term for this new agreement likely will go at least through the end of this current fiscal year, perhaps into the next fiscal year a little bit. We haven't yet decided, but those conversations are ongoing.
I would just like to, I wanted to bring this up. I understand those conversations are going on. I understand it's complicated with the FEMA reimbursements, but I do think it's important for my colleagues and for the county commissioners to understand that this has not been resolved. It is January of 22. And, I believe that, the benefits of the work are obvious. The costs of the work are obvious. And as we are making more decisions about ARPA at the county and you move through that process, I just want to express the need to move forward with some contributions from the county towards this effort so that we can plan, for additional investments into the health of our community more carefully. I don't know what the right answer, I don't know what the right timetable is, but I do think it's important that we're all aware of that situation. Thank you.
Thank you. Councilmember Tovo.
Thank you all. Thanks for all the continued work, and thank you for providing these updates. Just very quickly, do you have an update on whether or not monoclonal antibodies are available again in the state of Texas? And if not, do you have any estimate on when they might be? I know I saw The last report I saw was that Texas had run out of them. I happened to be in a conversation this weekend with someone who got COVID and received those infusions and said it was tremendously helpful to her recovery. So this is certainly an important resource and wanted to get an update on whether or not that's again available in our area. Dr. Walks, I believe you're on mute.
We had a shipment that came in last, finished in about 3 to 4. We're still.
Dr. Walks, can you get closer? We're not hearing this answer.
Can you hear me?
Just barely.
Barely. Sorry.
Yeah, that's good.
Is that better?
Speak up, though.
Okay. We had a shipment late last week that lasted for about 3.
Can you hear her?
Yes.
Just very, very barely. It's very light, Dr. Walks. And in your response, could you also remind the public how they may request it? I believe there's a hotline number through the state.
So there's a very short supply of the monoclonal antibody, and we frequently receive enough to last for about 3 days and then run out. And the way that the medication is accessed is by a referring doctor going to the CATRAC website and clicking on the link to the regional infusion center and completing the online form at that site. And that's how people will be able to get the medication. But there is a wait time, and we're hoping that there'll be more medication available in the coming months. But right now, we still have a short supply of it.
Dr. Walks, I think I heard you say that there was a shipment late last week to our community. The supply was used rapidly and
Yes,
is
that's
in short
correct.
supply. We're still getting small shipments, but they go very quickly.
Yes.
An individual should contact his or her doctor to get that process moving. What should someone do if they don't have a primary care physician?
They can go to any of the urgent cares or telemedicine physician to get care in that fashion. There needs to be a doctor that refers to the center. You might also call the regional infusion center and ask them if they have any other options available for them, but it's easier if you do it through somebody locally to get that referral to the RIC, as we call it.
Thank you.
Sorry.
Now we'll go to Councilmember Ellis. You're muted. Still muted. No. Okay, we'll come back to you. You can work on that with the tech folks. Let's go to Councilmember Poole.
Thanks, and as usual, my deep appreciation for all the work. I like seeing that spike start to drop. I do agree that we're looking more at an endemic situation going forward than a pandemic, which should change some of the ways people understand and act on how they should behave with regard to ensuring they do not catch the virus. So again, my thanks to Dr. Walks and to new director, department director Stirrup. Thanks so much. Also to Travis County. I don't have any questions, just gratitude today. Thanks.
Great, thank you. Councilmember Kitchen.
I wanted to, again, say thank you, and this is very, very helpful. I have 2 questions. The first one relates to, and I'm not sure who this goes to, the vaccinations in the schools. I appreciate the information about where the vaccinations are becoming available and are made available, and some of them are in schools, as I can see. But I'm wondering if you also have reached out to any of the private schools, for example, any of the charter schools such as Wayside. So that's the question. And then if someone wants to recommend a particular school, what is their process for doing that?
And so I'm sure by the time we move on to the next question, the staff will text me the answer to that. So
Okay.
hopefully before the end of the call, but if they call 311, they'll be connected to the mobile vaccine program, and they can arrange with that team to have an event set up at their location. I believe the emphasis between the city and the county was to make sure that we focused on Title I schools,
Okay.
the larger districts, but we are open to providing services to other schools in the area. We do continue to support Assistant Director Donna Sundstrom heads up the Child Care in Schools Task Force, so we're continually providing guidance and assistance. So there are avenues for both ISD and charter and private schools to connect with us to get services.
Okay, yeah, some of those charter schools do serve children that are of lower income. So that might be appropriate for some of those to be part of our target population. So what I'll do is I'll just send along to you, Director Stirrup, some suggested contacts. I hate for a school to have to go through 311. I'll pass that along.
Councilmember Kitchen, this is Constable Morales. We have been working with IDEA Charter Schools, Harmony Charter Schools, KIPP, and Wayside. We do have contacts there.
Okay.
And we continue to focus again on the high targeted areas of zip codes that are focused.
Right.
And so we did work and collaborate with Austin Public Health on some of those charter schools. Central Texas Allied Health actually leads our teams out there at the charter schools, and they do a tremendous job. So if you have any other charter schools, again, you can email Adrian Stirrup or Chuck, and then we can take it from there.
No, it sounds to me like you may be covering the ones I was interested in, but we'll send it along and you can take a look at that.
Thank you.
Okay.
We did do several events at the Ideal Public School last week, so we're continuing to work with them.
I'm sorry, I couldn't quite hear that, but that's okay.
We did do several events last week at the Ideal Public School, so we're continuing to work with them.
Okay. All right. Thank you very much. And then the last question is just, do we have projections at this point? It appears to me that from what you were saying that this surge is leveling off some, perhaps. Do we know? Can we say that yet, or do we have enough data to say that yet, or where do you think we are in terms of this particular surge?
It appears as though we are in the downslope of the case numbers. And as I said earlier in my early part of my presentation, there are a lot of cases that have not been added to our data bank yet. So you may not see that distinctly. But if you look at the hospital numbers, which are accurate, you're going to see a decrease or a plateauing in the hospital numbers.
Okay.
And the projections from the UT group show that we are possibly going to see a plateau peak in the first week to February timeframe. So if the community continues to do what it's doing with regards to getting vaccinated and masking, we hope that that will be the case and that we'll see this continue to go in the right direction.
Thank you.
And I just wanted to also add that the WHO is saying that we are still in a pandemic and not an endemic situation. So it's going to be important for people to understand that they need to continue to protect themselves and their families so that we can continue to function in society, keep schools open, businesses open, et cetera.
Thank you. Councilmember Kassar.
So I have a question on the vaccine data by
Oh, I'm
race
sorry.
and
Wait a
ethnicity.
second. I skipped right over Councilmember Kelly. Apologize.
Thank you. I was wondering if you might be able to give us an update on the isolation facility and how that's going as far as operations.
Our isolation facility we have 2 now, and last week they were both full and occupied with UT students, both on campus and off campus students, as well as persons experiencing homelessness and others. We're seeing a slight decrease in the numbers this week, but there's a continued need, and we are anticipating that need will continue for the next month or so, and then we'll reevaluate as to what the need is with regards to non-congregate sheltering.
Are we working directly with UT in regards to their students being housed there? Are they helping absorb any of the costs associated with running the isolation facilities?
Director Stirrup may be able to speak to that, but my understanding is that that is something that's being covered by the county and the city.
That is my understanding as well.
Okay, thank you.
Thank you. Now, Council Member Ellis, or do you have sound yet? Apparently not. Okay, then we'll still come back to you later. Councilmember Kassar.
So I have a question about the vaccine data by race and ethnicity. We've seen it a few times, but I think this may be one of the first times I see it laid out this way. And tell me if I have this wrong. But here, according to this data, it says 33% of white residents unvaccinated, 42% of Latino, 59% of Black residents, but then only 17% of the total residents. And I may be having something wrong, but my sense is that that doesn't make mathematical sense. I think if I remember a prior version of the chart, the reason is because there's a lot of people that don't have their race marked. And so then that is what makes it 17% of the total are unvaccinated, even though on the by race, it shows much larger numbers. Is that right?
Yes.
So I just want to raise here, because we put these out there to the public, and I know we're trying to use the flawed data that we have, it seems to me, now that I look at this sort of with fresh eyes for the first time in a while, that we're putting data out there that just isn't, that we know isn't right, that's like pretty far away from correct. Because if somebody looks at this and says, you know, 33% of white residents are unvaccinated or 42% of Latino residents are unvaccinated, we know that that's not true. We know that the number is lower. We know the disparity is real, and it's important to show that disparity. But I just want to voice here, and I'd be interested in you all's thoughts, if we know that these numbers are actually wrong, that actually way fewer than 33% of white Bostonites are unvaccinated, much fewer than 59% or 42% of Black and Latino residents are unvaccinated. I worry about us putting out data that we know is wrong, if that makes sense. I mean, I understand that the importance of showing the disparity because we all care about it or working on the disparity. I just worry that if we know these numbers aren't right, how we put them out.
So I wouldn't say they're wrong, but I will acknowledge and agree that there probably needs to be additional context to help the numbers make sense, to talk about the impact of the unknown category, the fact that the way that DSHS reports persons of multiple race doesn't always true up with the other systems. I'm getting texts in right now, the fact that our census is decreasing. And so when you look at the numbers based on, you know, what we think the overall population is. And so what we can do is provide more context that when we're sharing this information and figure out a different way for imaging so it's clear to the public. But I think the key point is that the disparities persist And when you look at Dr. Walk's slide about the comorbidities, what made me nervous is for our Black and Latinx populations, cardiovascular disease and diabetes are the leading causes of death. And so, there's a greater issue here that we need to take hold of and make sure that our community in those populations are informed, not in a fear tactic, but, just, hey, like, this is what it is in our community. This is what we're seeing. And this is why it's even more important for you to get vaccinated to protect yourself and your loved ones. But points well taken.
Yeah, I totally agree that the disparity is there, and that's obvious from from every bit of data that we have. I just worry that we send a message that say 60% of Black Travis County residents are unvaccinated if we in fact know that the number of unvaccinated Black Travis County residents is lower than that. We know that, we just don't know what the right number is because of the way the data is tracked. So it just might be useful for us to find a way to show the disparity without putting a number out there that if I were to ask you, do we think it's 60% of Black residents are unvaccinated? You'd say, no, it's a number that's probably well lower than that. You just don't know how much lower than that it is. Because there's no way that only 17% of the entire county is unvaccinated, but then amongst every racial group, it's more than twice that, except for Asian. So anyway, I'll leave it at that.
Councilmember Ellis, do we have you on the telephone?
Is that better this time?
All right, now we can hear you. Yep.
Thanks for bearing with me. I had a question, Director Stirrup, about the guidance that APH and the CDC are using and what is being posted with the State Health Services website. I heard there was a discrepancy there, and so I wanted to see if you could speak briefly about the guidance for childcare especially and schools. It seems that some of the isolation and quarantine for individuals is different on those sites. Could you speak to that?
I can, and I'll ask Dr. Walks to help me as well, because staff briefed me on the disconnect earlier yesterday. And what I'm understanding is while our guidance is reflective of what the CDC is putting out, and we communicate that to our partners, DSHS still hasn't updated their website and their recommendations with respect to communicable diseases and what the quarantine time is. And so that the state is what triggers the flexibility that the schools have in making changes. And so we're hoping, we're talking about that this morning, that an update will happen soon. So that is the high level understanding of what I have to it. So our guidance for staff still remains, it's in accordance with the CDC, but in terms of what schools can do with respect to the children, we just need for that update to happen. Dr. Walks, is that how you're understanding that disconnect?
Yes, the CDC guidance for quarantine and isolation changed, as you know, to allow for 5 days of isolation and return back to public settings with consistent use of masking. And the disconnect is that there is a provision in the current guidance that does not allow for a masking requirement. So there's some issues with working out those details, and it's important to know that from the science standpoint, the first 5 days is when 70% of the transmission occurs, and the last 5 days is when 30% transmission of COVID can occur. So if masking is not going to happen, then the full 10 days of isolation is required. And so the the issue is really trying to work through the details of how in a situation where masking is not a requirement, you can make those changes. So we are advising that if you are going to follow the CDC guidance, that you have to consistently have whoever's coming back wear a mask. And if they are in a situation where they take the mask off, they have to be, such as at lunchtime, they have to be given the social distancing requirements that are necessary to protect those that they may be around.
Thank you for that. That's really helpful, given all the back and forth that's happened around masking in Texas and in different municipalities and school districts. It's really unfortunate that there's this much confusion, because I know there's a lot of parents looking at the public health guidance and CDC guidance, and then to have different facilities saying, well, the state is saying something different, and it's all because of the confusion around when masking is required or not required and what powers these different entities have to enforce that. So that's hugely disappointing. I know there's a lot of parents I've heard from that are frustrated by this, and so I hope we can work together to get this streamlined moving forward so there's a bit more clarity for everybody involved. And thank you for your hard work, and congratulations to Director Stirrup on your appointment.
Thank you. Councilmember Renteria.
Yes, I also want to say thanks to all that's been out there. I know it's been a long time. It's over 2 years now. And, you know, it's just, I know that y'all must be really tired for all that hard work that you have put in. My question is, you know, there's the announcement that we're going to get these tests, 4 tests in the mail, and they're going to send it to you. But, you know, there's some families that have more than 4. And how would you recommend getting more than just the 4 that they're going to mail out to you? Y'all know what needs to be done by families that have more than 4 in the family?
And so, unfortunately, we don't have much leverage over the federal program, although we're appreciative of any help that families can give. Our response has been to continue to try to expand our opportunities for PCR testing. We know that sometimes if you don't use that home test kit at the right time within your infection period, you might miss it. And so by us having the sites and the additional resources that the judge mentioned to expand those opportunities and building out our mobile test team, we would encourage communities who, you know, don't have a home test kit readily available, that they come to an APH site or you call us to have us come out to your home to help you figure out if you have COVID or not.
Thank you for that information. Another thing is, you know, it's just like people like me that, you know, have gotten their vaccination and their booster, even though I got the variants, even though it was mild and with a sore throat for 2 days, and tested positive. What kind of recommendation you have for the people that have already gone through all this process and now they're negative? Do you recommend them still wearing the mask? Can they still catch it and pass it on to someone else if they already have been infected with the variants?
I would recommend that people mask. There is protection that's afforded people who have been infected for, we think, 90 days. But I would still encourage people to wear masks because there may be a chance of becoming infected. We know that we have lots of variants that are possible. We've seen that through the course of this pandemic. We started with one type of COVID-19 and now we are dealing with a 4th surge with a different variant. So I believe that masks are going to be something that we're going to want to consider as part of our wardrobe. many of us have made it part of our wardrobe. I remember you, council member, talking about just taking your mask off to turn and say hello to somebody. And, oh, by the way, you got sick. So I think just particularly people who are at risk for becoming ill, that they really should protect themselves with masking. It will protect them from COVID-19 and other things like the flu and other respiratory illness that's circulating right now during this time of year.
Thank you for that. That's all my questions.
Thank you. Councilmember Fuentes.
Yes, thank you. Good morning. Also, congratulations, Director Stirrup, on your confirmation, and certainly well-deserved and well-earned. So I appreciate all the work that you're doing, and happy to call you officially our Director of Public Health. Also, similar to Councilmember Renteria, I wanted to continue the conversation around our testing capacity. I know a lot of emphasis is being placed on getting PCR tests, but the reality is that we're also encouraging folks to schedule their PCR tests. And I had a constituent reach out and say, I went online, I tried to schedule my test. It was at least 2 days before they could get into the Southeast Public Library location, and another 4 days before they could get into Delco, or vice versa. It was one of those mixed, but it was at least days out before they could get a slotted appointment. And they didn't know what to do at that point. And so I think we're really missing a key component here of really emphasizing these at-home tests, because it's a way for us to truly curb the spread, and so that folks know, hey, you shouldn't go out this weekend, or you shouldn't go visit folks today because you have COVID. And I applaud our federal government and what they're doing in sending at-home test kits, but even then, we have to get the word out about ordering your test kits. And still, to the point that was just raised, there are some households that have more than 4 individuals within the household, and there have been issues with individuals who live in apartment complexes being able to place their order. Shortly before New Year's Eve, I requested what we were doing, Austin Public Health was doing, to expand our at-home test kit capacity. And it was shared with me that we had put in a request from the state of Texas. I have checked in nearly every single week to see where we are in receiving our allotment from the state. And if you could please share with us a little bit of have we received our test kits from the state of Texas, from DSHS? Any update on that?
Thank you. So first I'll say, just show up. If you are a person who's home and you're feeling sick and you want to get a test kit and you want to schedule it, I understand. I'm that person. I like to have control over my day, but this is the thing. Clear your calendar and come on in, drive through at the expo and get tested. Over half of the appointments that I mentioned in the first slide were walk-ups. We don't turn anyone away. We take anyone who's in line. It's kind of like voting. If you're in line when the site is scheduled to close, then we're going to see you. So please don't let scheduling an appointment be a barrier. We have the walk-up option for a reason. Secondly, we did receive a smaller cache of kits, and that was used for continuity of operations. A lot of council and commissioner staff coming back to work, and it's important that we keep our government safe and operating. And so we use that for those purposes. We are in the process of trying to execute a contract to purchase additional kits. And so through the EOC, city county teams are working on that together. And if we are successful and the demand is still there, the idea would be that, similar to during the holiday time, that we would use our Travis County and City of Austin neighborhood centers to help distribute those, along with our food distribution activities. If it makes sense and we can acquire enough kits, we will continue with the community distribution. For example, we gave the Austin Latino Coalition 20,000 test kits to distribute on their own to community, and we see that works. And so if we have the resources available, those would be the methods that we would use to get them out.
Thank you for that, and thank you for working with the Austin Latino Coalition to get those test kits out. So similarly, and I'm grateful that we're getting a FEMA testing site. Another concern that's been constantly raised by the community is the expanded hours and having hours where individuals can go to get tested after work or in the evening. What more are we doing on that end to expand our testing hours?
And so again, I would say, please do not go to work if you feel sick. Please come see us first. But understanding that that's not always a viable option for some. The team is looking at all of the testing assets that we have and how we might be able to modify services with the addition of this FEMA team. Is there something different that we could do with the APH sites? And so that is a continuing conversation. But from a public health standpoint, we really want to support the behavior that people prioritize the testing whenever possible. So working on it.
Thank you. And yes, I think folks would prefer to stay home if they were felt that they had COVID or if they had already tested positive and they were testing every day to see when they could go back to work. But unfortunately, there are workplaces who don't pay for you to be out sick. And so for a lot of folks, they don't have that choice of being able to wait the full time of getting through COVID. And having additional tests out there so folks can know, okay, I finally have tested negative, I can return to work, or having to make that tough choice of going back to work when they know they are infected, but they have no other choice because their livelihood is at stake. And so I just want to continue to impress upon our team here that we really need to expand our capacities to get these at home, the rapid test kits out into the community is extremely important. And I really want to see a robust plan for when we do have that supply available and when the external vendor contract comes in, that we are able to quickly mobilize and distribute the test kits in an equitable manner. Thank you.
Noted, thank you. Councilmember Harper Madison.
Thank you, Mayor. I appreciate it. I'll just echo my colleagues' sentiment and our appreciation for all the hard work and effort that goes into, us making sure that we have the most up-to-date. I'm going to add that to my vocabulary, up-to-date, hashtag up-to-date. Are you up-to-date? Get up-to-date. That said, up-to-date information because our constituents rely on it. So I appreciate all that effort. I really don't have any questions. I'd also like to echo the congratulatory sentiment for not only Director Stirrup, but also Veronica Briceño, who's not here with us, but we have multiple people who were able to ascend to a higher level and fully deserve it here at the City of Austin. So I appreciate watching strong, hardworking, powerful women ascend to positions of leadership. The one thing I would say in terms of echoing Councilmember Fuentes' deep desire to see more opportunities for robust testing. I get a lot of calls from folks who are hosting events. They're hosting a church event, they're hosting a community event, and they, ask me obviously last minute, but they're asking me, hey, can you deploy somebody to come do testing? Is that an option, or is that, does that sort of clog up the system when people are getting those one-off testing opportunities? Is that pulling away resources, or is it adding to?
If I had my way, if I had that proverbial tree that my mama used to reference in the backyard, when I asked her for something, I would say, hands down, have folks call us and we would try to accommodate. And, we are trying to accommodate wherever possible. So I don't have a clear answer because it's a resource question, and we don't want to pull away from our true public health purpose, right? And be there for the communities that need us. Although we do want our entire community to be healthy and safe. And so we're having conversations internally about how do we strike that balance and what do our services look like so that we're equitable, accessible, yet fiscally responsible. And so I will take that back to the team and see how we would approach different groups wanting to do large scale events and needing testing. And report back at our next briefing.
That would be helpful. And I really appreciate the pragmatism that goes into thinking about being equitable and accessible, but also financially responsible. I mean, all those numbers indicate something. So the ability to pay more staff, the ability to do more. So Dr. Walks talked about the data entry, for example. Would it help make the system more nimble if we had more people doing data entry? Would this be an opportunity to sort of repurpose some people who are out of work right now to just get in there and do a bunch of data entry? Would that help us, move along faster? So I certainly recognize the importance of making sure that our dollar goes as far as it can. The other thing I thought about was, as it pertains to that at-home stuff, some of the complaints that we get are, hey, I'd love to, get my groceries delivered, but I just have my house, I have my Lone Star card. That doesn't cover the cost of delivery. Hey, I'd love to get, not have to go to the grocery, but I need diapers, and then, I don't have the opportunity to get those delivered. So I just wonder if we're taking every opportunity to partner with organizations like the Austin Diaper Bank, like Family Elder Care, like some of those folks who can help us get the products in hands of people who are going to the grocery store, but they really don't have to. I would like very much to continue to explore those opportunities. Thank you.
Thank you. Director Stirrup, to making it almost unanimous, let me also congratulate you on the new role. You've done a really good job in the interim. These are tough times. This is a tough place to be, and congratulations to you, but also to your staff, which I know are being pulled so incredibly thin with the work that's being done. So thank you. The first speaker that we had today, the public speaker, raised an issue about J&J and wanted there to be a push to urge people to go ahead and get the booster if you had gotten J&J. And I think it was a little confused as to the CDC approvals with respect to that booster. If you had J&J, is there right now a CDC approval and recommendation for a booster shot? Either Dr. Walks or Dr. Stirrup, or Director Stirrup. You're muted, Dr. Walks.
Yes, there is.
And what is the recommendation or the direction at this point?
2 months after receipt of the J&J shot, the primary shot, you're to have a booster, and their recommendation prefers that you use the mRNA vaccines, either Pfizer or Moderna, your booster.
So after 2 months of the J&J, the direction right now is to go ahead and get the second shot, and preferably one of the mRNA shots. Is that right? You were a little
Yes,
faint.
sir.
Okay. So I'm not sure exactly what the confusion was in the first speaker, but I think the approvals that were needed are here already. Director Stirrup, did you have something else on that?
No, Dr. Walks got it covered.
Okay, I just want to cover that fast. On the UT modeling question, the University of Texas Modeling Group has done new modeling with the Omicron virus and looked at both national and international numbers as well as our local numbers, and is publishing real shortly a revised analysis that would show what the peak and the duration is. And as Dr. Walks mentioned, the most likely scenario is that our ICUs peak sometime between the 3rd and the 7th of February. But that model would show that pretty assuredly the peak before the 15th of February. And as you point out, Dr. Walks, we're still in a tricky place that it could, pick back up. We've seen it come down before. Probably looks good for events like South by Southwest in March, but we need to keep it down so that we don't get the additional variants that are still showing up. I had the same question Councilmember Gassar had with respect to the race issues, Director Stirrup, and I don't know exactly how to resolve that. He asked and answered a question for you, and I'd like you to actually answer the question. Do we think that 59-60% of the African American population in our city has not had any vaccine at this point? Or do we think that the number is lower than that?
So intuitively, we can infer that we think the number might be lower. And I hesitate to say what we think when we're talking about data. And so what I will say is that, we make the best use of the data that the state makes available. We know that the amount of unknowns causes some complication in digging that out. And early on when this was brought up, my time is lapsing, but it was in 2021, our epi teams try to chase down the data to get more information about what that unknown category consisted of. And it's really just a catch-all, and it's reflective of either people's self-selection not to identify, or how the state identifies people of multiple races. They just get put into the unknown category. And so it's really hard for us to tease out what the exact information is. But, the same points that he made, math, census, taking all those things into consideration, we do believe that particularly in the Hispanic and Latinx population, there's some underrepresentation there as well. But we'll take it back to the teams to try to figure out how we can get a cleaner view of what the data is. But right now, we're just trying to make the best of what's available to us.
And I appreciate that. I'm just scared that there'll be a headline that'll just say 60% of the African American population hasn't gotten a vaccine, even a partial vaccine, and probably that's not right. So how do we avoid that? You might want to take a look as you look through that at actually putting the other bar on there too, and maybe there's a way to put a number associated with each of then the 5 bars, so that you can get a relative feel for how they impact the total line of 17. But however you do that, but I do share the concern that someone looking at this quickly, uninformed, might not know the important context that you're talking about. Again, thanks to everybody that we're doing. It's good to see that our mortality rate continues to be so much lower than other cities in the state and the nation, which is a real indicator of the work being done here locally. Judge, those are all the questions I have. If you're ready, I'll close out the city council meeting.
Yeah, I just had one thing in response to Councilmember Fuentes' question about sort of the hours of testing. I know that we had a meeting with the federal vendor, I think yesterday, and asked them to, instead of ending the testing at 6, to end it at 9. And I think they will do that for this, at least for this federal site. So hopefully that will allow some people who have to work during the day to go afterwards for that specific need. But just wanted to highlight that as a direction that I think the federal site is going. But that is everything I have, Mayor. If you want to close out your part, I think we'll close and come back at 11.
That sounds good. Colleagues, it's 10:50 right now. I think what we're going to do is I'll convene in a moment the general meeting. You don't need to come to that because I'll immediately take us into executive session. So at 11 o'clock, let's all meet in executive session. We'll talk about some of those items. The outside consultant is with us. At 1 o'clock, we have Kroll with us. So between 1 and 4, we'll do that second one. Hopefully we can take care of the executive committee stuff before we come back for that. I appreciate everybody going on the message board with respect to indicating committee interest. We'll touch on that, but I don't think that's a long conversation because everybody can sign up for whatever committee they want to. It's more just letting everybody know what it is that people want to do, and I have a couple questions about that. So with that, and anticipating seeing everyone in executive session at 11, but recognizing that I'll go on in the general meeting right now to reconvene just as soon as you can get me up. I'm going to go ahead and close out the city portion of the joint meeting here on January 25th, 2022 at 10:51.
Thanks all.
Thanks. And we'll adjourn the county side until 11 o'clock, and we'll adjourn the joint meeting as well. Thank you all very much, and thanks for all your work. We'll see you soon.
All right. Good morning. I'm going to convene the Austin City Council meeting here today on Tuesday, January 25th, 2022. The time is 10:57 a.m. We're going to go ahead and go into executive session to take up 3 items pursuant to 55107 of the Government Code. We're going to discuss legal issues related to items E2, Smith v. City, E3, Nobles v. Egal and Johnson, and E1, lawsuits and claims related to APD. We're going to go into executive session on the items announced. The time is 10:57, and we're going to go into executive session. Anticipate we'll be back in and around 1 o'clock, maybe a little bit earlier, for primarily the Kroll report and a quick discussion on committees. Thank
Mayor,
you.
quick question.
Yes.
I had to sign off from the joint meeting, so I missed any discussion about what you were thinking about for lunch today.
I think we can figure that out in executive session, how long that will take us, but the Kroll report folks are not with us until 1.
Okay.
And we don't have any pulled items.
Right.
So we'll handle the stuff on executive session, I would imagine, at that point, and then break and then come back at 1. We need to touch base on committees quickly, but anybody can be on any committee they want to. So I don't think that's going to be a very long discussion since it's just committee membership today.
Yeah, it looked like pretty much everybody had laid out what they wanted to do for 2022 on the message board, which is great.
Okay? All right.
Thanks.
We'll see you all later.
Si negaras mi presencia en tu vivir, bastaría con abrazarte y conversar. Tanta vida yo te di, que por fuerza tienes ya sabor a mí. No pretendo ser tu dueña, no soy nada, yo no tengo vanidad de mi vida. Doy lo bueno, soy tan pobre que otra cosa puedo dar. Pasarán más de 1000 años, muchos más, y yo no sé si tengamos la eternidad. Pero allá tal como aquí, en la boca llevarás sabor a mí. No pretendo